to another episode of Late Night Discussion. We're happy that you're here, of course, as usual. If you're now joining the live, ensure that you encourage your friends to come on the live and be part of the discussion. Encourage your family members to come in so they can share in what we are sharing tonight. Of course, you can share the link also. You can copy the link and share it in your Facebook groups and your WhatsApp groups so persons can be a part of the information sharing tonight. My name is Randolph Christian. Of course, I'm happy that you have joined us tonight. Tonight, of course, we have, as advertised, we have, let us just apologize, we did not get Dr. Quincy Jones, but of course, we have a very capable person that is going to be joining us tonight, CARICOM Youth Ambassador Vishal Joseph, to my extreme right. And of course, we have Dr. Van West Charles, no stranger to the public eye. So we're going to be joined by these two. Should I say from the new school and the old school? I don't want to say old, but
generations of politics.
Right. Of course, Vishal is also in the medical field. So we are joined by two medical persons, I should say, and we are going to be discussing. I know the technician is there with you. Yeah. Right. We are going to be discussing, of course, the COVID-19 virus that has taken the world and caused major shutdowns, major disruptions, and infected a number of persons, and is responsible for a number of deaths, and the death toll is rising every single day. Here in Ghana, we have, of course, our COVID-19 task force, and they have been issuing statements, and they're on the job. I know they had a press conference, I know the minister had a press conference today, and we encourage you to stay tuned to the Ministry of Public Health's Facebook page for information on what our response is. I know last night we spoke about our senior citizens and the need for us to put provisions in place so that we can accommodate them during the time that they have to collect their pension. As promised, we will be sharing the information with you on what are the things in place so that we can accommodate them and we can ensure that they don't have to leave their homes to collect their pensions. For those persons who may have to leave their homes, I know that things are in place for you to meet at a location where there's adequate spacing. As we know, we're talking about social distancing and social spacing. Right, so I'm going to allow the professionals tonight to talk to you about what exactly is, because a lot of us are running away with some ideas, right? We're going to talk about exactly what it is. So I'm going to allow, I don't want to say the elder statesman, but the senior of the gentlemen on the panel tonight to lead us off and kind of give us an idea of what we're dealing with when it comes to COVID-19.
Thank you very much, Randy. Good evening, everyone. Vishal. COVID-19, as you know, emerged in China in December of 2019. The microorganism is a virus, coronavirus. There are many types of coronavirus, but this is very specific, and this time because it's mutated over the period. We had first MERS, then SARS, and now we're challenged with corona. These are viruses that undergo mutation. In this case, we're seeing rapid transmission from person to person. And initially, we thought it was in person to person based on the information out of China, but we are now clear that it's done by person to person. So hence, the fact that there is no vaccine at this point in time, we know that we have to ensure that we reduce transmission significantly. There is the evidence clearly that there are a number of risk factors, especially people who are in the older age group. But I think we are also seeing some middle-aged people coming down and actually dying. So although the death rate is not as high as about, I think, just about 2%. The rate of infection is high.
Yes.
It's very contagious, and therefore it is very important that the fact that there is no vaccine, that we use the basic public health measures, and we take the public health measures very seriously in terms of mitigating transmission at the community level. So I think what has happened as we learn every day, we're learning every day about the virus and the modes of transmission. We do know that there are a number of myths, and Vishal will deal with the myths and get into that. But we do know that the virus presents with fever, coughing, sneezing, some respiratory distress in some cases, and for you to come to a point of diagnosis, you've got to be exposed to the virus by someone who may have been in an environment. For example, the case we had here in Guyana, where the person came from Queens, New York, where the transmission was going on. The person wasn't well, and the people in their homestead was exposed to the virus. Now, we have got to be very, very careful in terms of how we conduct our surveillance and how we conduct the closeness. We are people that like to hug and shake hands and do all this type of physical connection. And that has to be averted at this point in time. The social distancing is very, very, very important. And I think we haven't, I don't think as a country, really taking that on very seriously. I think if we can say that, especially young people seem to feel that, oh, well, this is for an old people thing, but it isn't an old people thing. We can see that in Florida and in New York, physicians themselves have come down, having been exposed to the virus. But I think it's important for our young people, because if you look at the demographics of this country, we've got a broad bottom with a lot of young people, teenagers, young adults and so. And I think they need to understand clearly what is happening with the transmission. So let me stop here for a while and allow Vishal to deal with the young people. I will come in as we go ahead.
Right. Thank you, Dr. Trans. Randy, just to state it, I think I might have made a faux pas when I said generations of doctors, not a medical practitioner yet.
Yes. Yeah.
Right? So still student doctor.
Yeah.
But let's look at the user aspect. I mean, going out there and interacting with persons on social media, whether it's just Facebook, WhatsApp, texting, and so on. There have been a lot of concerns. People are asking, am I at risk? What are the risk factors for, me contracting COVID-19?
Yeah.
And, the generic answer is that, you have extremes of age, the very young, the very old. But then there's also one aspect that is usually overlooked, and that would be persons who have respiratory diseases or other pre-existing conditions that would sort of compromise your immune system. So you've got diabetes mellitus, HIV, of course, if you would have had a prior viral infection. So that's one thing. And then you also have the fact that, a lot of these young people are saying, hey, well, I can still go out to Starbucks Market to pick up my bowl of soup, or I can go to Lime on the Seawall, the district, and so on. But the thing is, the invincibility of youth is limited. And in this case, what you find is that those young people who are going out there, they might not necessarily infect themselves, right? Or rather would not be severely affected by the infection that they would pick up. But they have to be cognizant of them taking that virus back home to their mothers, their fathers, their siblings, even their own children. if they do have
Yeah.
such. And be cognizant of the fact that they too can be affected, right? It's just that they are at lesser risk of being compromised by the virus.
So I want to ask a question because we've been hearing a lot of things. Part of my understanding is that a healthy person is very likely to be able to fight off this in a couple of weeks. How true is that? And
Well, so the incubation period for the virus is between 2 to 14 days,
Yes.
right? Like most other viruses, until and unless other information is released. A healthy person with a non-compromised immune system
Yeah.
should be able to fight it off. I mean, your body has a natural response, and the immune system by itself, sort of mounts a response through your T cells to execute your infected cells by ordering them to commit cell suicide. And this, in the initial stages, can be a bit much, and that can actually tell you. That's why you present with symptoms. You get a fever, you get the distress, you get the nausea. You just generally have this ill feeling about you. But then your body starts to progress, and that's how you fight it off. And that's also one of the reasons why they're asking persons that if you do exhibit any symptoms, self-isolate for about 2 weeks, because that actually gives you a chance to fight it off naturally. And of course, if you don't feel that your body's fighting it off naturally, you may contact with your healthcare facilities.
Okay. I want to make one point, especially in terms of who is healthy and how you define healthy. That a lot of our males in this society don't necessarily go to the healthcare system easily.
Yeah.
When they get to the healthcare system is when it's most likely at the end of the road. There's a major crisis. So the issue is with this virus. When we meet, we don't know who you have been in contact with, or you have been in contact with.
Yeah.
I have been in contact with.
That's right.
So, in actual fact, transmission may have occurred on your side, or on my side. But we are close. And transmission then, either one of us can be transmitting the virus to each other.
Yeah.
So the social distancing becomes critical at minimal. In the healthcare system, physicians should stay around 6 feet away from the patients. And so when we introduce social distancing in the offices, in the homes, in the transport system, I think we have to understand must adhere to it, or else everybody is going to be infected exponentially.
Yeah.
Exponentially.
Yeah.
So if you're coming from, say, Vreeden Hoek on a boat, and those boats are packed, no movement. Any one person on that boat who has been exposed
Yes.
is now exposing the entire boat
Yeah.
to the virus.
Yeah.
In a minibus, likewise.
Yeah. And the thing is, because I had a personal experience, I normally say my sisters, she's usually paranoid about everything. Now that this is so, I had to stop at the door. I had to take off my shoes, take off everything. She had to spray me down before I get in the house. Because and what she was saying to me is, look, it might not affect you, but you come in here and there's a baby in the house, there's a small child in the house. These are the persons, and there's an elderly person in the house also. These are the persons that she's trying to protect, right? And this is very, very important. As Vishal was saying, you might be able to fight it off, but you might pass it to somebody else who's in that vulnerable group, and that is part of the problem that we're facing, and we'll come to later on. These measures of containment that we're trying to put in place.
But this simple surface here that is in front of us, it is not simply the hands, the washing of hands, and
Somebody touch it.
all of the surfaces,
Yes.
right? And the virus can remain on a surface between 2 to 9 days,
Yeah.
right? So all of the surfaces need to be cleaned properly. Even you go to a sink and you come out of the bathroom, you wash your hands, but you hold the sink, you contaminate again.
Yeah.
And then the doorknob.
you know, the doorknobs. So I think we have to understand how the transmission is going and to take it seriously, because if, and let me paint the picture for us, if in this society this virus spreads exponentially, and I don't think we are clear as yet what's the state of play with us in society, but you have to have people hospitalized. We are going to have a great challenge.
Yeah.
If you just look at what's happening in the USA, in Europe, and in Asia. So it is important for us, a country that doesn't have a lot of resources, to embrace the public health measures and understand the public health measures. You know, I heard that there was a comment from a guy in a minibus when there was passengers were talking about distance. And he said, well, I gotta make my money. And that is foolishness. You know, everyone has gotta be on board to understand what we are talking about in terms of the public health measures which must be embraced by everyone of us.
Yeah, that's right. I think that's very important. I know we hear terms like flattening the curve. Persons may be curious what they're talking about. My understanding, we're talking about reducing the spread, reducing that spike in how many persons contract the virus. So this is basically so that we don't have our healthcare system overwhelmed.
That's right.
Because if everybody gets it, then there's pressure on the resources, as you said, right? So we like to, I like to say, listen, this is a containment game. You have to contain what has happened already, because the barn door has already been opened. It has spread all over the world. It's put pressure on the economies of so many different countries. How we interact socially, everything has changed in a matter of months. We have to now contain so that everybody on the planet don't end up with this thing. Because we're gonna really put our resources under pressure, and that's part of what people need to understand. Last night, Mr. Ramjitan spoke about that personal responsibility that you have, right? Not only to yourself, but to your family, your friends, to the rest of the country, right?
This is a communicable disease. It's notifiable by the Ministry of Health. Has made it clear there are forms to notify the Ministry of the infections and so forth. And you can get to a stage if you knowingly indulge in behaviors inimical to the health of the community and people around you, you are committing a criminal offense.
Yeah.
I think we need to understand, and I am not too happy with the way our society is moving in terms of making a change. I'm happy that I can see the Linden and New Amsterdam have started to put some measures into place.
Right.
This is very, very welcome, and I think Georgetown needs to move immediately to a shutdown with measures whereby our bars and so forth and are closed, our discotheques, our restaurants, etc. And the gathering of people, you've got to reduce that. That's why they're talking about social distancing and the transmission. You know, you may say, look, some people may say, well, who's going to pay me? But after you die, nobody has to pay you.
You know, that's it. How are you going to make money if you don't have your life? As we delve in here, treatment, because, and this will come back to these myths that we have about. We hear all sorts of things, garlic, stand up in the sun, all manner of things are out there, scientific, herbal. We have a whole lot of treatment, we have a whole lot of doctors that jump up now, social media doctors that tell you what to do. I want our public to be guided as to what exactly it is that they should be doing once you would have contracted the virus.
Alright, so let me jump a little bit back now.
Yes, go ahead.
So, about these things with garlic and, using hot water to have your baths, drinking hot water, living in hot environments, using your blow dryer to blow your face and so on. the body self-regulates, right? So trying to adjust your body's temperature is not going to help your case. And whilst, you know, traditional medicines and even Western medicines that have been, or rather Western supplements that have been used to build and maintain a proper functioning immune system, they are only efficacious to that point, to build and maintain, but not as a rapid response, as a treatment. There's no known cure or vaccine for the coronavirus.
Yeah.
It is in fact an analog of the SARS. Is actually caused by the severe acute respiratory syndrome related COVID-19 virus, or coronavirus, sorry, which then causes COVID-19. So persons need to understand this is something new that is being researched. There is a rapid response, and the best thing that you can do is not listen to facts and simply follow the instructions of your public health officials and centers or authorities. As relates to what you should do, now if you as a person, you know, realize that you are exhibiting symptoms of infection, then of course you need to self-isolate. And this goes for everyone. I've seen some of, you know, my peers say you only live once. But the thing is, you only live once, YOLO, but do you care for those around you? Do you care for those in your community? How are you impacting their lives by exposing them, if you are?
Yeah.
So outside of your self-isolation, of course you do your self-isolation, you observe yourself, and if you do see that these symptoms are progressively worsening, then of course you contact your public health authority and they will tell you what to do. Do not go to a healthcare facility unless instructed to do so.
Yeah.
All right?
Doc wants to jump in here.
Yeah.
Look, all of these facts we need to understand are basically nonsense. This virus is intelligent. When you're infected, it takes over in the host DNA. And initially, our immune system is unable to deal with this virus. So that's why we're saying the aging, people with other comorbid conditions, diabetes, cancer, HIV, all of these things, will be at a very, very high risk in combating this. I worry when we say I'm healthy, because I don't know.
Yeah.
And if you have asthma, and this virus, it gets into the body of the lung, right? And it more or less, the concept is like if you're being strangled for air, right? So when you are infected and you are placed in an institution, so much is dependent in terms of trying to maintain your respiratory system so that the rest of your body can function. Now, I want to say to the general public, fever is one of the early symptoms and manifestation of this virus. And we have to be careful, we have to note it. The literature tells us today that when people are diagnosed, they're being hospitalized. Initially, probably 4 to 4% of the patients present with fever, but by the time, another 2 days later, 89, 90% of the patients are presenting with fever and the other symptoms, cough, etc. In this country, our pharmacies are sometimes too open. And so people are purchasing steroids without prescription. This is a no-no, and pharmacists and pharmacies should avoid providing steroids to anyone without a physician's prescription. Because then you increase viral replication if you use these steroids without a physician guiding how this is taken.
Yes.
So we have to be very, very careful and understand immediately, you know, even in healthcare institutions, the healthcare personnel should be checked on every shift.
Yeah.
If there is a temperature rise, and then they should be moved out of the institution. So we need to be understanding the symptomatology, the symptoms that this virus presents, and as Vishal says, what you should take and do. You self-quarantine, you observe, and at this stage, so many people have been coming and going and interacting with people. It may be difficult because he may meet through someone else, but is unable, does not know if this person was in contact with someone who arrived from overseas.
Yeah.
You don't know. So we just have to be monitoring the symptoms very carefully, especially if you see coughing, the fever, respiratory distress. I think make contact with the Ministry of Health hotline immediately.
Yeah.
They will get to you, and we will begin to do the surveillance and monitoring that we have to do as a country, and practice the personal hygiene, the distancing, and that type.
So, for example,
If I may add,
yeah, jump
I love the point that Dr. Charles brought up about steroids and so on. I'd like to add to that as well, antibiotics. There are a lot of persons who are going about there saying, oh, well, you know, I can treat this with an antibiotic, and I saw it in some video or so on. Antibiotics are not meant for viruses. Right, that's the first thing. I'll leave it to that. They're not meant for viruses.
Right. So this is it now. So for the person who is looking on right now and went to the pharmacy and bought all these fancy things, because they're concerned, people are scared, people are concerned about what they can use, right? Because they're hearing all these things. I know vitamin C is a big one, and people are saying, okay, boost your immune system, use your vitamin C tablets, buy your oranges and fruits that are high in vitamin C. What say you on that?
Yeah, look, eat nutritious food. Your vitamins, your proteins, your carbs, etc. Eat nutritious foods as part of your daily regime, and even indulge in some exercise.
Okay.
If you're at home, practice deep breathing exercises outside on your veranda or wherever.
Okay.
Don't self-diagnose. Don't self-treat.
Yeah.
Avoid that.
Okay.
And practice good basic hygiene.
Right. So that's the basic model. Eat healthily, practice good hygiene, things that we're supposed to be doing.
And for the men,
Yes.
avoid the alcohol for a while.
Yeah. And persons, because we know that smoking compromises your
That's right.
lungs
That's
and your
right.
respiratory system. So, you want to do yourself a favor in these times.
That's right. That's right. I mean, it's very basic. We were taught from the primary school level that
Mhm.
eating a balanced diet helps to build you a strong immune system.
Yeah.
So don't think that going to purchase vitamin C now is going to give you a magic cure or a magic wall. It's going to help over time, but it's not something that's going to react, oh, I take it today and then tomorrow I'm okay.
Yeah.
And, everything in moderation. Your body can only use so much.
Yeah.
The other issue is that you gotta cook your food properly. Cook your meat, your vegetables, cook them properly. The virus can be destroyed at about 56 degrees Celsius and above that. But ensure that your vegetables are cooked properly, or your meat, etc. If you have pets, there is no evidence that is transferred from pets to humans, but your pets got to be clean, ensure that.
Yeah.
So it's all about basic hygiene again. And we have to get back to the point, this is going to help us as a country in helping our young people our children get back to the stage of good hygiene practices. I would hope that education, the teachers are looking and understanding that these are things now that we have got to pick up. And as they get back to school, indulge in these practices.
Yeah, that is a concern. Persons are still concerned as to when we will get past this and whether or not the prescribed time that we have right now is enough. Because school have been closed for a while and they added some more time, so students will be going back to school after their Easter break. I'm hoping that we're able to get to a place, even if we don't get past this fully, but we're able to work out something where when the students get back to school, they're able to exist in an environment where they understand what they have to do to prevent this.
Even if they arrive at the vaccine in another few weeks, we need to embrace the public health practices to avoid another contagion, which may be worse. You know, I was reading that in some cases the reinfection with the virus has occurred and it's worse clinically. So we have to ensure that in the schools, and this is where I come in now as managing director of GWI, we have running water.
Yes.
That the children have soap in the schools, education, and that the children are taught as they go into the bathrooms and they come out, they need to wash their hands properly and so forth. So this, and the society as a whole.
Yeah. I think we're moving to a place of responsibility. I know that a number of business places would have set up their hand washing stations there. I saw that the Rotary Club they made an effort to put 4 sinks down at the Starbuck Market area. And persons are more conscious. I made a joke the other day that this is the most famous action now. Everybody from the bus conductors to taxi driver, everybody's rubbing their hands with some sort of sanitizer or something. We're getting to a place where we understand that this is needed. I like what Vishal said earlier when he said, when we talk about not panicking, but being concerned. Is that what you said?
Yeah. It's not a time to panic, but a time to be concerned.
Yeah.
I mean, of course, if we go and you know, we do irrational things and we decide that, you know, we're going to buy all the Lysol
or all the toilet paper, I don't know why.
Exactly. it's irresponsible. I mean, from a health standpoint as well as from a socioeconomic standpoint.
Yeah.
You brought up the point of hand sanitizers and I've noticed on the market there are a lot of, you know, hand sanitizers being sold.
Yes.
But I cannot stress the importance that any alcohol product that you're going to use to sanitize your hand needs to be at least 70% alcohol to be.
Let me see if mine is 70. Yeah, I have 70 here.
Perfect. and you know, outside of that, your proper hand washing techniques, that's something we actually need to teach.
Yeah.
I think that's something that we can start sending out to homes and so on. Teaching especially younger kids, you know, how to wash their hands properly, inside, outside, around the base of the thumbs and the wrists and so on. And of course, you spoke about panic. Now, a lot of persons are going out and they're buying Lysol and they're buying face masks and so on. If you do not have an active infection or you're not suspected of having an infection, it does not make sense to wear a surgical face mask. Unless you're infected or you're caring for somebody who is infected.
Yeah. The other thing is, look, this is behavior change, so we gotta be each other's keeper. So many people still haven't seen it as a routine practice to be washing.
Yeah.
So in some cases they forget it. So if you observe somebody, you know, they may have entered the bathroom, they're coming out and they go straight past the sink.
Yeah.
You gotta just remember,
That's right.
you're exposing yourself, and to protect yourself, have them go back to the sink and wash. This is a behavior change at the level of society, at the level of community. So all of us need to be each other's keeper in trying to ensure that we all practice indulge in good public health practice.
Yeah. And I echo those same sentiments. For persons who are now joining us, we are having a live discussion tonight with Mr. Vishal Joseph, CARICOM Youth Ambassador, CARICOM Youth Ambassador and medical student, and of course the Managing Director of GUIWA, Dr. Van West Char, GWI. GWI, yes. Dr. Van West Char, and we of course giving as much information as possible about the coronavirus and how you should go about keeping yourself safe, should go about ensuring that you understand what it is, how it is that it is contracted, what you can do to keep yourself safe and your family safe. And friends, I want to push on now to this idea of the general public and the role of government, the role of I don't want to say civil society, but the government's role in ensuring, because I know we heard stories of the 17 persons that came back from Barbados recently and were subject to that quarantine. And again, we heard a lot of stories, but at the end of the day, there's a responsibility to ensure that we don't bring in anything and we spread this thing further than it has already spread around the world. I know that Linden would have taken the initiative and imposed the curfew on their citizens up there. Your general thoughts on how we move forward as a nation in terms of that?
Well, I think, look, it's important that we get to a point where we understand what is going on. Education is critical.
Yes.
So, as people enter the country,
yes,
our people at the front, at immigration, etc., need to become educated about what is happening with this virus,
yes,
and how it's transmitted, etc., and why we have to do certain things. When we don't take time to educate our people, then people react and people do all sorts of things.
yeah,
So increasingly, and all of us have got to become educators, all of us in this room, in our homes, in our community, our friends, we got to check in to be sure that they understand, because when you say we have myths, because they're reading, and now what is happening with access to the internet, there's so much fake news on the internet, that we need to be working with everyone so that we understand. Now, at the end of the day, the government has a responsibility to protect its citizens.
yes,
And therefore, in the area of public health, they've got to have a position at a point. If X is placing the community or the society at risk, that person has, and doesn't understand, that person has to be dealt with. You cannot permit that one person to cause damage to a community and the country as a whole. And therefore, that is where government's responsibility is. The issue of the testing, ensuring that people are tested and diagnosed, doing the surveillance systems, that is the responsibility of the government. And at the same time, reporting, which the government is doing now, reporting to the general public as to what is happening, because we're a democracy and information is one of the hallmarks of a democracy. Public health information is important for us to understand what is happening, the spread of the disease, etc., etc. And I would say that even in the private sector, and this is a societal responsibility, because when we define government, we put it in a very narrow terms. The private sector has a responsibility also to work with government, articulate with government at this stage in terms of ensuring that the practices and the information we're talking about. But the government must see that private sector to other partner in this, especially the private health sector. Insurance, health insurance companies that are involved in health insurance, is my personal belief, they should be stepping up to the plate to assist the national effort in terms of education across the country.
Yes.
Because at the end of the day, if a lot of people are ill, they have to pay more premiums outside.
Yeah.
So both national insurance, private insurance, etc., should be stepping up to the plate to support the Ministry of Health in terms of its educational programs going forward. All of the mechanisms got to be in place for it to happen.
Yeah. And I know this is affecting many sectors and many facets of people's lives. For example, persons have rents to pay, persons have mortgages to pay, and I know their efforts on, like you said, the private sector, the banks have already said that they will, forego the loan repayments until a certain time. I know that the GRE said that those payments of PAYE and certain other taxes have been deferred until, I think it's June?
Yes.
June, the end of June. A number of things have to be put in place so that we can ensure that we can get through this, because it affects everyone. I don't know if you want to jump in here, Vishal.
Well, yeah, like Dr. Charles would have pointed, the private sector must support the government. I'd like to expand upon that a little bit, and it goes to all players. One thing that I would have learned from the regional response is that the best campaign is one where you're doing your job, right? And the public health ministry has been doing a whole lot to ensure that they reduce the rate of infections, or rate of new infections. And there are some private sector companies and businesses as well, even on America Street, for example. I was made aware that a few of those stores are handing out free hand sanitizers and so on. So there has to be a collective effort, and we have to be at a point where this is about national unity and about fighting something that's threatening the very way of life of the people of this country.
Yeah, and I don't know if Mr. Charles is going to talk to us about the things being put in place, GWI, to cushion what is happening right now.
Let me, before I get there, I just want to say that at a political level,
yes,
the political voices outside have been quite silent in terms of trying to become involved at the national level and support the national strategies. I don't think that at this juncture, health should be a political football.
Yeah.
And therefore, all political actors, you've had so many parties participating in the electoral process. Whether you are at or not, you agree. But I think it's a part of the political maturity that you must demonstrate to become involved in a national effort to ensure that everyone is on board. Staying away, it tells me that you're not serious about the development of your country, because human capital is what drives the development of this country. And so I would expect, and I'm sort of disappointed, that many of the political actors have not been raising their voices in a way that they are coming on board, at least to see that this is a national effort and that they should be working, understanding what is being done by the Ministry of Health, by PAHO, supporting CARFA and the task force, etc. But to be sitting on the sidelines, and becoming Pontius Pilate, washing my hands and not doing anything and not supporting, is sad.
Yes.
Now, back to your question.
Yes. So,
If I may add there as well, I even saw on social media some of the candidates from those political parties trying to,
downplay
this pandemic as a political scheme.
There's a statement that the fight for democracy supersedes the fighting coronavirus.
Well,
It
it shows where priorities are. And I'll say this, even the case of the persons who came in from Barbados was used for political points earlier today.
yes.
And I'll state this, the facts are simply this. There's a group of Guyanese that were trapped in Barbados because there were no flights coming out of Barbados and not coming into Guyana. They made a charter arrangement with Trans-Guyana Airways to get to Guyana through the consulate of, through the Guyanese consulate of Barbados, knowing what the conditions were that they were going to come to meet in Guyana. They
Yes.
were going to be quarantined, they agreed to these things, right? And those are the facts. Any other thing that you hear out there is simple fallacy used for cheap political points.
Yeah, of course,
You know,
of course.
I think we have to call it because it doesn't help us as a country.
Yeah.
And as I said, I just want to reiterate, it tells me if you couldn't be serious in terms of your intent for the development of this country. And if it's one thing that has to be set aside, if you are the biggest racist, there's one thing this virus doesn't know race,
Exactly.
right? So let us try to come together as a people and let us deal with this as a priority. Without people, you have no democracy. So you can talk until the cows come home about democracy, but if there are no people in the country, then that's it. Now, GWI is the sole producer of water in this country, and the water is one of the principal products in terms of the public health strategy at this point in time. So we are seeking to ensure that water is available in the communities. We just completed an analysis looking at squatter communities, and we're trying to see how best we can find the resources now, put forward to the government to ensure at least there is access at the standpipe level within these communities so that there is water available. We have worked also, we've looked at the internal staff, those who have got kids who are at home from 0 to 12, that have no one to take care of the kids. We've entered into arrangements with them that they can stay at home or they can rotate, they can work at home.
Yeah.
And so we're doing those things. In some cases, transportation, the vehicles are parked, I know, for example, in the case of Region 5, at that police station, and we're supposed to be moving in. We've ensured that all offices have got supplies available for all staff, operational staff, in the field, in the customer service, etc. that they are. Also, from the time they log on to their computers, they are driven to a site which teaches them about COVID-19, teaches them how to wash their hands, etc. And then, when that is finished, then they can proceed to do the work of the company.
So, someone asks, and I'm trying to ask, about the bills. People, they're hoping that their water is not cut off at this crucial time.
It's a situation whereby, as far as possible, people have got to pay the bills.
Yes.
Because in order for you to have water, potable water, we have to purchase chemicals. So with this environment, right now, for example, we've got to ensure that we have all of the chemicals for another 4 or 5 months. We normally will bring chemicals from as far as Turkey. We can't do that.
Yeah.
So we're now trying to ensure that we can have some of the chemicals out of Jamaica and out of Brazil, so that we will be in a place where we have to ensure that we have the reagents to be testing the water. We do test water here in Georgetown on an hourly basis because it's surface and groundwater. So we'll continue to ensure that the access to water plus the quality of water is maintained. But we want to encourage our customers to pay, because without that, I've got to pay salaries. We can can look at and see how we can work with pensioners and so forth. But we understand the importance of the water, so we want to have a win-win situation.
Yes.
Encourage those who have the resources to pay, and we keep the system going.
So, again, if you're now joining us, we're having a COVID-19 discussion on all of the things that come with that, with CARICOM Youth Ambassador and medical student Vishal Joseph and Ms. Dr. Van West Charles. We are quickly winding down, and I want to take us to the responses that we would have seen around the world. I know different countries have instituted various measures to kind of contain, because like we said in the beginning, we have to contain the spread of it. Lest we be overwhelmed by the amount of cases if everybody gets infected. So containment is the name of the game, and various measures would have been implemented around the world. I know in the United States they have instituted stay-at-home calls and lockdowns in certain communities in certain states. In your general assessment, is that something that we should think about in the near future?
Well, we have to look at it, but we have to, when we started off this program, I think Vishal made the point, we must not be in a panic.
Yes.
What we do and what we must be guided by is evidence.
Yeah.
We must be evidence-based. Because resources are scarce, and we have to be very careful how we are spending resources. I would much rather, for example, see us using money to have more kits available.
You said testing kits.
Yes. Than to be using, I don't think washing of the streets and washing of markets are necessarily evidence-based practices in terms of dealing with the contagion. I think we have to be very careful. Now, we are in a country that likes to use a lot of paper, despite the fact that we have a lot of computers. And we still haven't come to the mindset of being paperless, and hence we can work from home and do many things, right? We are still struggling that in many of our practices, we have to be at the office.
Yeah.
The first world, we are seeing changes in these practices, and even our own workers have got to understand. If I have a deliverable, it has to be delivered at a certain time. So if I am at home, then my manager, my supervisor has confidence that I'm going to deliver. Now, in the offices, we have challenges in terms of the social distancing.
Yeah.
So clearly, we have to run different shifts. And I am of the view that this is an opportunity for all of us to look at how we may do things differently, more efficiently, to bring greater effectiveness. Because in some cases, many people may not necessarily have to be in the office 5 days a week, but they can work and do things from home. If I may be in customer service, I would say, look, I need you to touch base for the next 3 days with 120 customers about their bills and so forth. We work that out and so forth, so they're not necessarily for you to be in the office. So this is driving us to think out of the box, how we can do things differently in the country, get to a paperless system. People may think, if you look at auditors, for example, if they have access to your systems, they can start to do work. They have to go and be there and to do their work.
Yeah.
So, what has happened in the first world is something that we have to look at. But we have to think. We are not parrots. We have to examine the situation for ourselves. We have to look at it and see what is possible in our own environment. That's why we are independent, you know. So many of the things that you do, in medicine there are virtual consultations, and therefore we have different types of contacts with our patients and so forth. So
Yes.
those are things that we have to begin to change as we are in the 21st century, and using technology is very critical. Look, I was just looking at remote devices being used in China to do certain things in the area of health. So there are different things that this is an opportunity for change, and we see it from a positive side also.
Yes. Yeah.
Well, we speak about resources and about thinking outside of the box as well. A friend of mine, mentioned that he's busting his brains trying to find out where he's going to get Lysol and how he's going to keep his family and his home disinfected and sanitized and that sort of thing. So I'd just like to throw in a few things here quickly. As it relates to cleaning your surfaces with alcohol-based sanitizing methods, you can actually just use methylated spirits or any alcohol solution, alcohol product rather, that is at least 70% alcohol. And even for cleaning surfaces, a very cost-effective disinfectant would be a solution of bleach, which would be 5 tablespoons to a gallon for cleaning all your surfaces and stuff.
5 tablespoons of
Yeah, as simple as that. I mean, think about it. Do you think that the hospitals, especially in the public health system, they're going to be using Lysol everywhere?
Yeah, Lysol is very expensive.
So
So a bleach is pretty effective.
It is.
So okay.
So those are things that but I think it's important for us to look at what is going on, but at the same time analyze it in terms of our own context.
That's right.
Yeah, definitely. And I'm happy that we share this information. What I want to inform you is that, of course, the Ministry of Health, they have their hotline numbers, and those numbers, I'm going to ask one of our operators back to put those numbers in the chat, and of course, we will be putting up the numbers on the page after this live. We'll have a poster up with the numbers, the hotline numbers that you can call, because one of the things that we heard very early is that if you believe that you've contracted the virus, and you're showing signs or symptoms, do not go to the hospital. Make the call. Get the advice from the professionals on what to do and how is it you go about quarantining yourself. So we want to encourage persons to use those hotline numbers and call if you or your family member displaying signs or symptoms of the coronavirus. Ensure that you call the numbers and you get the information on what to do. Time is quickly running out on us here. I'll invite Vishal to some closing comments as we're about to go out, and then Dr. Charles before.
Well, it might be a matter of duplicity, but I was actually going to give you the hotline number.
Oh yeah, no, go ahead. The persons who are listening can take it
yes,
now.
and for those of you who missed the information earlier, so the numbers would be 227-4986, extension 215 when prompted. And this is between 8 a.m. to 4:30 p.m.
Yes.
And in the evenings, it's 624-6674
Yes.
or 624-2819. And this runs from 4:30 p.m. to 8 a.m. the next morning.
Right. So you have the numbers, and of course, there's some other numbers that will be posted on the page as soon as this live is over. Dr. Van Charles.
I would want to say to the general public, don't put yourself at risk. Social distancing is critical, and try to ensure when you're going into a bus, you're going into a boat, if
Yes.
you haven't got that distance, then do not enter it, because you're putting yourself at risk and other people at risk. And ensure that you indulge in washing your hands properly with soap, spending a minimum of 20 seconds. But this is very, very critical. You need to be at home, not in the road very often, and avoid crowds as much as possible. You can say your prayers at home, you haven't got to go to church, you haven't got to go to the mosque, you haven't got to go to the mandir. Just protect yourselves.
And just to add to that, as we close, public transportation, as you said, you might be sitting in a bus seat that somebody sat in. When you get home, ensure that you take off your clothes, ensure that your mobile devices are also wiped down, ensure that you do the things that you need to do to protect yourself. We want to thank you very much for joining us tonight on this session on COVID-19. Thank you very much, Mr. Joseph and Mr. Van West Charles, for joining us, and we hope that you join us here tomorrow night again for another late night discussion. Do ensure you keep yourself safe. My name is Randolph Critchlow. Thank you very much for joining us. See you again tomorrow night.
Great.
Thank you very much, gentlemen.